Earlier this week, Governor Hochul warned that COVID cases are once again on the rise, along with the seasonal flu and RSV cases. A lot of parents worry about that RSV. And with the holidays coming up, protection is the best medicine.
Despite the threat of rising cases, the number of New Yorkers getting the new booster shot remains low. New York City Health Commissioner Dr. Ashwin Vasan joins us live this morning to reiterate the importance of getting vaccinated, especially before all gatherings of the holiday. Good morning, Dr. Vasan. Thanks for being with us.
Good morning. Thanks for having me.
So you actually spent Halloween in isolation after testing positive for COVID on Sunday. So how are you feeling?
I'm feeling better and better each day. I was sad to miss my kids trick-or-treating, but I'm getting better quickly, and I attribute that mainly to the fact that I've had my immunity updated. You mentioned the booster. It's a bivalent booster, so it covers the major circulating variants of Omicron, and the fact that I updated my immunity recently in September, I think is a big reason why my symptoms have been as short as they are and as relatively mild as they are.
Help some folks understand, because a lot more people I know are getting COVID right now, and they've been reaching out to me saying, hey, what do I do? The CDC guidelines have changed so much over isolation. What happens when the 5-day period is over?
Yeah, it's a great question. Look, we know that people are most infectious in the first 5 days, which is why everyone should stay home for a minimum of 5 days and isolate from others. Now, in an ideal world, if you've got access to testing, or if you're in a job where you can't afford to miss more than 5 days, testing negative is ideal. So repeating your rapid test, getting a negative, or repeating a PCR and testing negative is an ideal scenario. But we understand that not everyone's in the luxurious position to have that. Yeah. So what we're saying and what CDC recommends is that if you're fever-free for up to 24 hours, then you can come back to work as long as you're wearing a tight-fitting mask. You can resume your regular activities, and you wear that mask consistently when you're around others for up to 10 days. Because we do know that a small subset of people will continue to test positive even after they're symptom-free.
Oh, good advice. Well, why do you think we are actually seeing this upward trend in COVID cases? Should we be worried about that?
I think it's not entirely surprising, right? We are entering into our first quasi-normal winter in 2 years, right? We do not have a lot of restrictions on movement, on gathering. We don't have any mask restrictions in place, which is why, and I think that's a good thing in the sense of we are moving into a winter where people can celebrate with their loved ones, congregate as normal. Last year, we had hoped to do that, and then Omicron came out of nowhere. And so we're excited to have a safe holiday season, but this is why the message about getting your booster now before the holidays, getting your flu shot at the same time, is exactly what every New Yorker needs to be doing.
Okay, so just for the sake of just kind of calming down what we're going to see play out this fall and winter, right? You had the bivalent booster, and you still got COVID. And Omicron came out of nowhere last year. Boosters are low right now in terms of bivalent. And so what are you expecting to see this season? Are rising cases, but everything be mild? Or you want to see those numbers of boosters get higher?
I most definitely want to see those numbers, those booster numbers get higher. Look, no vaccine is a fail-safe. The fact that I got it, even though I'm boosted, does not speak to any intrinsic failure of the vaccine. What it means is that if everyone takes the bivalent booster, overall, we'll see transmission go down.
Okay.
Person to person, that might vary. So this is really about us being in this together. I want to see those booster numbers increase, which is why everyone can call 877 VAX for NYC, make an appointment for both their COVID booster and their flu shot. We have pop-up sites happening all around the city at community-based organizations. We were out at Halloween in Jackson Heights over the weekend, and we'll continue to do that. And you can go to pharmacies, CVS, Walgreens, Duane Reade, or your primary care provider to get vaccinated now.
We want to switch gears just a little bit. So hospitals are also being inundated right now with young children suffering from respiratory infections or RSV. Pfizer says a vaccine won't be available until next year. So what can parents do right now to keep their kids safe?
Look, I mean, and I'm a parent, I have 3 small kids, and all of my kids have had RSV at different points. almost all kids will get RSV before the age of 2. So that's just something to level set with everyone. And for the vast majority of children, that's going to be a mild illness, like a viral illness that gets better on its own. Now, we're entering into a winter where for the previous 2 years, we've had restrictions in movement, we've had mask wearing. So we have a group of children whose immunity is not the same as ordinary kids pre-pandemic, which is why we need to be extra careful entering this winter to keep our hand hygiene up. If you're feeling sick, stay away from kids, especially kids 0 to 1, and practice those basic behaviors of normal winter hygiene entering these cold months to prevent viral transmission. But it's not surprising that we're seeing an uptick in flu, that we're seeing an uptick in RSV, along with an uptick in COVID cases entering the winter. But we are prepared to deal with it. And, you know, right now we're not seeing any excessive strain on our system.
I just want to squeeze in one more because I was reading, I'm a new parent of a 4-month-old, and I was on the parenting blogs. Some people were even saying, Doctor, I'm going to keep my kid home from daycare or preschool because I'm so fearful of RSV. Is it something that, as a parent, it's really tough to see your kid sick, to say it's okay maybe to get it, to boost their immunity or boost their immune system that has been not put out there in the past 2 years because of COVID? Do you get what I'm saying?
My 3-year-old is sick right now, not with COVID, but with something else. And it's never fun to have your child be sick. I get it, and I've been through it 3 times now, so it's not fun.
Triple whammy.
But we allow our kids to move about the world and to be exposed to different things, and it does build up their immune systems. These kids, the kids that particularly were very young during COVID, they haven't had that same level of exposure. So we want to get back slowly to a world in which they can move freely and be exposed as normal. But this winter in particular, since it's our first sort of quasi-normal winter, is going to be a particular concern for parents. So I totally understand where parents are coming from. I'm one myself. But I think we want to all get back to the pre-pandemic world where we moved about and were exposed normally, and we would get maybe sick once a year or twice a year.
All right, Dr. Ashwin Vasan, thank you again for being with us, and get better soon. Glad to hear you're better.
Yeah, thanks so much.
By the way, my kid had croup, and let me tell you, it is not fun.
It's not fun. I agree.